Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Sarjapur and Bellandur units of Bangalore. Preterm labor in multiple pregnancies like in twins, triplets, things. Usually in this present era, twins is common. Triplets is very rare because triplets, even if it is there, couple are opting for the fetal reduction at a early gestation. By 12 to 14 weeks they see the NT scan and then they are going for the fetal reduction if they don't want to continue triplets. In that, one fetal reduction will be done. So the risk of preterm labor is why more common with the multiple gestations, because imagine yourself, the uterus, the stretch of for the uterus in a single baby carrying a two babies will be more. So for example, at 28 weeks, the uterus size will be of 32 weeks. Sometimes if along with that fluid also, if it is more, it will be like 34 weeks of gestation. So the pressure on the cervix and the uterus stretch can lead to preterm labor in the twin pregnancies. So what we have to do, how we can prevent that? So usually multiple pregnancies, if it is there, we give the progesterone support, we monitor the cervical length, and sometimes some patients we add tocolytic medicines which can prevent the uterine contractions, and progesterone support, mainly the vaginal progesterone what we give, that will prevent the preterm risk. So but still, even in spite of all these problems, risk of preterm labor. So for that reason, cervix, when we monitor, if the cervical length is less than 2.5 centimeter, we do put the cervical cerclage. The other school of thought, the olden days, the seniors still do believe that any twins better to put the cerclage at 14 to 16 weeks after the NT scan, because ultimately maybe at 24 weeks or at 28 weeks, they are at risk of short cervix or the leaking. These kind of problems can be prevented by prophylactically putting the cerclage. So nevertheless, the latest medical guidelines tells that you can follow up and observe, put on progesterone and support with rest. So if this is not helping, then cerclage can be done. Apart from this, why preterm risk is there in the twins is sometimes in monochorionic, where the single placenta and both the babies share the amniotic fluid is different, cavity is different for the babies. So those kind of babies, some babies fluid will be too high, the other baby it can be less. So these kind of patients also, the pregnancy may not go till 36 weeks, 37 weeks like that. So those kind of pregnancies, we may have to deliver early or interfere and do intervention procedures for the decreasing the fluid in one so that it will optimally grow. So these anastomosis can be coagulated, laser ablation, these kind of procedures can be done. So other risk why twins are at higher risk is sometimes what happens with the monochorionic, one baby if it is not growing well or anything, ultimately over the time the other baby also may have some complications. We have seen that one baby's heartbeat will go off suddenly at 18 weeks or anything, or sometimes little more early. Then the other baby will be fine. Sometimes over the time that baby also will lose the heartbeat. So these kind of problems are more common with the twin pregnancies with the monochorionic, single placenta. So the preterm risk is because of the excess stretch which is happening. So be under rest, follow the instructions given by your doctor. And this way the preterm birth, if necessary, the steroid coverage will be given for the twin pregnancies, because it prevents the respiratory distress or the gut infections or the spontaneous brain hemorrhage, bleeding which it will occur, intraventricular hemorrhage. These kind of complications can be prevented by giving the steroids. So always follow the instructions given by your doctor, and twin gestations, the ultrasounds and monitoring will be little more required. Like as I mentioned, the electronic fetal monitoring will help in preterm labor, the multiple gestations. So use the facilities and contact your doctor if any change is there, less movements, pain or leaking, any problem if it is there. Because so many times the patient feels that water is already leaking, but I thought it is urine, they think like. So any problem, water leaking, anything is there, you have to meet the doctor, because mainly in the twins, because of this stretch, the risk of preterm labor will be there. So in such scenario, the monitoring and the management will be a multidisciplinary, and neonatology team to support in the good management of twins will be very helpful.